Breathing with Emphysema by Gcassman. Objectives. In this, you'll learn about the etiology of emphysema, the specific cells, tissue, and organs that are affected, organ systems that are affected, signs and symptoms, treatments and prevention, and short and long-term consequences. What is emphysema? Imagine living life and doing activities every day that requires you to breathe. Take a deep breath in and let it out slowly. Our lungs are an essential part of our body. Without them, we would not be alive. Now imagine doing the activities and living life with a lung disease. It would be so hard on yourself emotionally and on other organs and other parts of our body if we could not breathe properly. Chronic obstructive pulmonary disease, COPD, is also known as emphysema, is one of many lung diseases. Others are cystic fibrosis, bronchitis, asthma, pneumonia, pulmonary fibrosis, and pulmonary embolisms. People with these diseases know how hard it is to breathe, and many have to be on oxygen to be able to function properly. The etiology of emphysema. There are tiny air sacs in our lungs called alveoli. When the alveoli fill up, it is known as emphysema. Again, which is also COPD. The lungs are the main organs affected by the disease. The alveoli are the smallest breathing tubes in the lung. When the alveoli fill up with air and the air in the sacs build up, and it makes it hard to breathe when the lungs are expanding. The alveoli turn into large, irregular pockets with holes in them. The surface area on the lungs gradually reduce, resulting in less oxygen entering the bloodstream. The small elastic fibers that hold open the small airways, leading to the alveoli, become destroyed. When the patient breathes out, they collapse. Example is the patient has problems exhaling the air. Organs and system functions affected. Lungs are the main organ affected by emphysema. The respiratory system is affected, and bronchioles are the passageways the air travels through the nose or the mouth to the air sacs in the lungs. In a person who has emphysema, the respiratory system is affected. In the respiratory system, there are also bronchioles that are passageways that the air travels through. Bronchioles divide into smaller bronchioles or terminals, then divide down into even smaller respiratory bronchioles that divide into the alveolar ducts. Bronchioles can either decrease or increase the airflow, and each lung has a primary bronchi, the left and the right, and these bronchi connect to the secondary bronchi. The secondaries flow to the third section, which is also known as the bronchioles. Next slide. Signs and symptoms. A major sign is shortness of breath, coughing, tightness in the chest, wheezing. A barrel chest is when the rib cage is rounded out from the increased air pockets, so it looks like their chest is bigger and rounder and kind of sticks out from their belly. Clubbing, increased sputum, pursed lip breathing is a way of breathing when someone has COPD. They hold their lips together and try and breathe through their mouth versus their nose. And then cyanosis. Major symptom of emphysema is shortness of breath. Like I said, coughing and tightness in chest, or with or without pain or wheezing. Some symptoms are less common, such as depression, poor quality of sleep, decreased sexual function, and weight loss caused by appetite. The symptoms of emphysema usually start between the ages of 45 to 60. However, some can be very young. Other signs that the doctors look for, like I said, were the barrel chest, the clubbing, malnutrition, uh, treatments. There's all kinds of treatments that can help the COPD. Bronchulators are like inhalers to help the sudden breathing attacks. Steroids help decrease the inflammation of the lungs. Antibiotics can help clear up the infections that the lungs are more susceptible to infection. Oxygen, if they're having low stat levels, they may need to be on oxygen. Surgery, there's a couple different types of surgery. They can remove part of the lobe and then transplant. Um, you have to go through like an evaluation to have all these tests run, and they also um, evaluate you if once you do get the lung, overall health-wise, if you will have a better life longevity, and they can do a single lung or a double lung. Other things that could help are steroids will help with the decrease of inflammation. The surgery where they remove the lobe is called a bulectomy. Next slide. Prevention, obviously, if you're a smoker, the first thing you should do is quit smoking if you're diagnosed with emphysema. Emphysema has no cure. The symptoms can be controlled. Eventually, emphysema will lead to death if there's no intervention as surgery or anything like that. It just is a progressive disease. Emphysema is a slow progressing lung disease. The only short-term effects is to quit smoking and to take care of your body. Medicines like inhalers and steroids will help lessen the sudden short of breath symptoms. Next slide. Long and short-term consequences. Shortness of breath, not being able to do these activities with ease. Imagine being in your room and, for example, when my mom was sick, she couldn't walk 5 feet from her bed to the bathroom without being short of breath. Long-term consequences, not really consequences, but surgery, transplant. With these interventions, life can somewhat be normal again. Emphysema is a slow progressing disease with no cure and eventually results in death. And that is my reference page. Thank you.